Good afternoon. I am Barbara Albiger, and I'm the head of communication here at the European Center for Disease Prevention and Control in Stockholm. Welcome to this press conference on the Andes hantavirus outbreak situation. I am here with ECDC Director, Dr. Pamela Rendi-Wagner, Dr. Gianfranco Spiteri, who is the ECDC emergency lead on this outbreak, and also the lead of the ECDC Epidemic Intelligence, as well as Dr. Andreas Hoefer, who is overseeing the operational coordination of the EU reference laboratories for public health, including those specializing in zoonotic viruses like hantaviruses. This press conference will be approximately 40 minutes long and will be divided in two parts. ECDC will first give a brief summary of its role during this outbreak, the action taken, and what are the next steps, after which the floor will be opened for questions. But before I open the press conference, I would like to mention a few housekeeping rules. Like, we kindly ask you to mute your microphone during the speaker's intervention, please. Thank you. And there are two ways to ask questions. You can either raise your hand to get the floor to ask your question directly, but please do state your name and the media you are representing. The second way is you can also leave your question in the chat, and likewise, we would appreciate if you could leave your name and the media you are representing. Finally, I would like you to be aware that this press conference is recorded and it will be released on ECDC channels afterwards. Thank you very much, and I will now give the floor to the ECDC Director, Dr. Pamela Rendi-Wagner.
Thank you very much. Good afternoon, ladies and gentlemen. Also from my side, a warm welcome to ECDC's press conference on the current hantavirus outbreak, and thanks for joining us today. As you all know, we originally planned to have our expert who has been on the cruise ship for 3 days to be here today with us. He arrived very, very late last night, and he is extremely exhausted from the intense mission. He asked to stay at home today to rest, and of course, I and all of us, we fully understand. Nevertheless, I want to take this opportunity to thank him publicly for this remarkable operation and work in the past days. Coming to our conference today, we will focus on 3 main topics. First, we will give you, of course, a first report about the experiences and the main findings from our ECDC expert who was on board of the cruise ship. Second, we will present a summary of ECDC's actions, activities, and support actions for the member states during the last days. And the third main topic of today's press conference is we will, of course, give you an epidemiological update and the latest news on the current outbreak, and present you the next steps and also the guidance for the member states regarding the management of the passengers who are now back in their home countries. Well, since May 2nd, as you know, when ECDC was first informed by the Netherlands about an outbreak of unknown etiology on a cruise ship, indeed a lot, has happened in a very, very short time. And I'm not exaggerating, ladies and gentlemen, that this outbreak and this situation poses a very complex outbreak situation due to many uncertainties and the involvement of 23 nationalities. Due to many of these uncertainties, and especially the long incubation period of Andes virus, up to 6 weeks, ECDC consistently has applied a precautionary approach from the beginning of the outbreak, a so-called no regrets approach. With the recent disembarked passengers now testing positive in the past days, our approach proved right. And it is important to say that due to the long incubation period, it is still possible that more cases among the passengers who are now actually in quarantine will occur. This cannot be excluded. So now that all passengers have been safely repatriated to their home countries under very strict and safe precautions, it also shows that we have learned many, many lessons since the pandemic. We is the European Union, the member states, and the ECDC. So what kind of lessons did we learn in the past years? Well, first of all, about collaboration. Cooperation and collaboration is key in crisis situation. It's like that. So the efficient and good collaboration with the affected member states now and in the past days, first of all with Spain and the Netherlands, the collaboration with the European Commission, UK, but also WHO is really outstanding and very good. Secondly, in outbreak situations like this, it is key to assess as quickly as possible, despite many open questions, despite missing data at that point in time. So ECDC made a risk assessment last week, including first recommendations within 2 days. We also provided detailed rapid advice to the member states for the management, like the care of the patients and the passengers, the disembarkment, and the transfer of the passengers. This was not only right to do, it was also extremely important to assess and advise so fast in order to be able to decide quickly on key decisions, such as should the passengers take commercial or special flights home to their countries in Europe. Well, ECDC clearly recommended that all passengers should go on special flights, and this is to avoid any further risk of spreading of the virus. All of this was done within a very, very short time. Well, thirdly, I have to say that ECDC in parallel, as you know, activated the European Health Task Force and deployed within half a day an expert on board of the cruise ship who entered in Cape Verde, where we will give you short reports about his experiences and his main findings right in a few minutes. A second task force team of ECDC was sent to Tenerife to support with the same safe disembarkment of the passengers, and we supported mainly the Spanish health authorities in doing so. In addition, ECDC activated right at the beginning the new EU reference laboratory for rodent-borne and zoonotic viral pathogens to offer a fast diagnostic support to the national laboratories in the countries, and we will also provide you more details on this and the next steps. So, what is happening now and in the upcoming days and weeks? First of all, ECDC will continue to give updated guidance to the member states, how to manage the passengers who are now back in their countries. Most importantly, I have to say we recommend a strict quarantine for all asymptomatic passengers for 6 weeks, which means until June 21st or June 22nd, depending on when they left the ship. Via the reference laboratory, we will support to ensure a fast and, even more important, a high-quality diagnostic in the member states. Moreover, ECDC experts will now focus their investigations, their research on 2 main questions. First, how and where were the passengers infected? We need to learn more about the routes and the patterns of transmission of this virus. And secondly, we have to learn more about the virus itself, its transmissibility, its severity, and this will be done in the upcoming days and weeks via more genomic analysis. I will end here summarizing. So far, I can say this is a best practice example of good European teamwork. It's a good example of effective use of new tools such as the European Health Task Force or EU reference laboratories, which are now available in the European Union since the pandemic. All these new tools enable ECDC and the EU countries to respond more timely, more efficiently, and better coordinated in outbreaks. And with this, over to you, to the PSG manager, Andreas.
Thank you, Pamela. So I will give an update on the epidemiological situation and then some information which we have received. In terms of the epidemiology, we are seeing 11 cases reported so far. We have 8 confirmed cases, 2 are probable, and 1 which is still being verified. We have had 3 deaths among the cases so far, and 3 persons are still in intensive care or severely ill. ECDC, as the director mentioned, has been very actively following this event, and our colleague has been deployed in Capo Verde and on the cruise ship since the 6th of May. On the cruise ship, the colleague has found a situation which was very calm. He boarded the ship after the last 2 symptomatic cases had left the cruise ship, and his role on the ship was to support the outbreak investigation, provide information on prevention and control, and investigation and further investigation of the event. He also supported the coordination with colleagues from the Netherlands who also boarded the ship. So 2 medical doctors boarded the ship to support the clinical care on board, as well as coordination with the Spanish authorities to support disembarkation. During this time on board, there were no symptomatic persons on board, so the team assessed all the individuals who were on the ship regularly to identify any symptomatic persons, and there were none at the time. And they also provided advice on infection prevention and control measures on board of the ship. These recommendations were already being followed by the passengers on the ship. The passengers understood that this was essential to prevent further transmission, and these measures included wearing of masks, social distancing, and limiting contact with other passengers, and this happened regularly. The colleagues who boarded on the ship in Cabo Verde were of course also following this advice, and wearing the appropriate PPE as according to our recommendations. And in general, this we have seen that this has been followed throughout. Also during the disembarkation process, there has been very careful following of the control measures and the prevention measures, which have been recommended by ECDC and by the Spanish health authorities. And I think maybe that is kind of a summary of the situation on board, which Ettore found when he boarded the ship. And of course, there were, as the director mentioned, additional colleagues deployed in Tenerife to support disembarkation when this was happening in the last couple of days.
The next step.
Oh yes, and in terms of the next steps, the passengers, of course, as you know, disembarked. They have been repatriated through collaboration with member states and the Union Civil Protection Mechanism, which is coordinated by DG ECHO. We have been in contact with the Spanish authorities and the Dutch authorities to support this repatriation process. The repatriation process happened using the full measures that we recommended. The passengers were not using commercial flights, so they had specific flights organized for them to go back to their countries. And when they were in the countries, they were received by public health teams to follow the quarantine measures which ECDC and the member states have recommended. And the quarantine measures then are in the hands of the member states. So this would be implemented following the guidance from ECDC, but implemented at national level based on the resources available and the specific recommendations within the countries. Next steps for investigation. Yes, so we are following up the investigation process, the data that our colleague has collected on the ship is being analyzed currently and has been used also to identify persons who might have been at higher risk because of contact with other passengers who eventually became cases. In addition, we are collecting additional data in collaboration with the Dutch authorities, WHO, and other agencies on the risks on the exposures which the passengers had. And this will, of course, inform both the response to this outbreak, but also additional events in the future. So we hope to learn much more about this event and this virus outbreaks in the future. And this will help us respond and prevent illness in the event of such outbreaks. And there is also quite a lot of testing happening of passengers during this process. We are providing some guidance to member states on the approaches for testing, both for, of course, the symptomatic persons, but also asymptomatic persons, which are being monitored in the respective countries. And this will support both the early isolation of patients. So if any of the persons under quarantine develop symptoms, and we have seen a couple already develop symptoms, then they can be detected early, they can be isolated very quickly, and this will reduce the risk of onward transmission to the general public. And this is why we, in our assessment of the event, we assess the risk as very low to the general public. The event is being dealt with by ECDC and by the member states in a very effective manner. If we all follow the quarantine measures which have been recommended by ECDC and by the countries, we would prevent further transmission and reduce the risk to the general population even further.
All right. We give the floor to Andreas Hoefer.
Thank you very much. I'd just like to say that since the very beginning of this outbreak, the EU reference laboratory responsible for hantavirus has actively reached out to every member state to make sure that every country across the EU has access to the diagnostic materials that they require to perform the testing. It's important to note that since the pandemic, since the beginning of last year, the ECDC and the European Commission have designated 10 such EU reference laboratories for public health. These reference laboratories for public health do not just respond to events like this, but they're very actively engaged, and they have been for the last year and a half, to prepare and to strengthen capacity so that when an event such as this one happens, we're able to immediately respond across the EU. With regards to what's known about the virus, preliminary investigations based on the whole genome sequencing that is available to us suggest that there are no indications that this virus is acting any different from the known virus circulating in some regions of the world. All sequences obtained to date are virtually identical, which means that there was likely only a single transmission event from an infected animal to a human. And lastly, on this point, the investigations also suggest that all of the diagnostic techniques that are currently being used in the EU will work very well. Given that at the moment we have a very limited amount of data available on the sequencing side, it is very, very important that every laboratory and every partner working on this event share this information in a transparent manner so that everybody has all the data necessary to guide public health action. Thank you.
Thank you very much. So now it is the time to open the floor for questions. I remind you, you can ask your question directly if you raise your hand. And I have a question from Rory O'Neill from Political. So please unmute yourself and ask your question.
Hello, thanks very much. Can I ask, what's ECDC's position on whether hantavirus can be transmitted by asymptomatic patients, and do you have a different position to the US CDC, which is their guidance seemed to suggest that transmission could only occur with symptomatic patients. Secondly, if I can, the French Prime Minister yesterday called for stronger cooperation between EU countries on hantavirus. Do you take that as an implicit criticism of the level of cooperation so far? And
Thank you very much.
do you think
Top.
coordination between EU countries to be improved?
Yes, so maybe I can start by answering the question around the symptomatic transmission. So the evidence that we have seen on Andes virus infection is that persons are most infectious on their first day of symptoms. So this is very clearly known. We also know that some persons can test positive before the onset of symptoms. So in our recommendations, we follow this evidence in the sense that we explain that the risk of transmission is highest on the first day of symptoms, but since the virus can be found in the blood in the days before onset of symptoms, in the first couple of days before onset of symptoms, then we assess that there might be some risk. So in terms of taking a preventive and a highly precautious approach, we recommend, for example, that contact tracing should be done for the 2 days before onset of symptoms as well. The risk there is very low, most likely, and there is no literature, no evidence that transmission has happened before onset of symptoms. But in terms of following a public health approach, we recommend to contact trace even before, for the first 2 days before onset of symptoms. And in terms of the collaboration between the countries, so Director can cover.
Thanks, Gianfranco. Regarding your question about the cooperation, I can only say it from our perspective, the cooperation at the level of the public health authorities of the member states, the Commission, WHO, and us as European Center for Disease Prevention and Control has been very, very strong, very efficient from the beginning, starting at the weekend of the 2nd of May. And so there were meetings every day, almost at night, not one, many, many more, at all kinds of technical levels, member states levels, because it was so important for us not only to have a clear line, but have an agreed and coordinated approach and way to move forward. And this was seen, otherwise it would have not been possible to organize the disembarkment of the passengers in such a fast, speedy, and efficient manner.
All right, we have the next question to be asked by Joseph Corbella from La Vanguardia.
Yes, thank you. Can you hear me?
Yes, we can.
Okay, perfect. Thanks for taking my question and for organizing this press conference. I wanted to ask about the French patient who is now in intensive care. She developed symptoms when she flew. Well, she's actually in critical situation since Monday, I think. From the literature we have from the outbreak in Argentina, the prodromal phase is between 3 and 6 days, and that seems to suggest that she should have started to have symptoms at around Friday, so when she was still on board. So I would like to ask, when you said that no passengers had any symptoms when they onboarded, what specifically was done with this person? Was her fever taken? Was she asked every day how she felt? What was done to be sure that really she did not have symptoms? Because this might be otherwise a case in which she has developed this serious situation in a very short time. Thank you.
Thank you.
Thank you for the question. Indeed, her onset of symptoms was very, very soon after disembarkation. All the passengers who were on the ship were examined before leaving the ship, and none of them were symptomatic at the time. So this includes, of course, the French lady. I understand from our colleague who was on board the ship that her temperature was also checked 3 times, and she did not have any fever on the 3 times that this was checked. So as far as we know from the information we have, we still believe that she did not have any symptoms while on board of the ship. But of course, we are waiting for further information also from our colleagues in France who are investigating this case. And we also see that the pattern of the disease might vary from person to person. So there might be some differences in terms of how patients present from one case to another.
Thank you. And we are giving the floor to Kai Cooperschmidt from Science Magazine.
Yes, thank you very much. So I wanted to ask about the guidelines you've drawn up together with WHO and others. It's my understanding that while they were being drawn up, there was the idea, of course, to distinguish between the high-risk contacts and the low-risk contacts. And at the end, the decision was made that everybody on board the ship is going to be treated, for now at least, as a high-risk contact. The quarantine, as I understand it, is only recommended for those high-risk contacts. And so one of the questions I have is there still the possibility that epidemiological investigation is going to lead countries to downgrade people from the ship to say they were low-risk contacts and they don't need to be in quarantine? Or is it the ECDC's position that regardless of what comes out of these investigations, all of these people on the board, the crew, and the passengers should be treated as high-risk contacts and complete 42 days of quarantine?
Should I start? Yes, please.
So I will start, and then Gianfranco can give you more details on that. As you see here, I mean, we had very good discussions in order to have one agreed line how to manage the passengers coming from the ship. And as I said before, for us it was important, due to the many uncertainties at that point in time, to take a precautionary approach, which means classifying all passengers on board as high-risk patients, because we had many, many open questions regarding their exposure. So saying this means all of them were treated the same way with regard to the transfer in special planes home to their countries, and the same applies to the recommendation of quarantine for 6 weeks, period starting with the disembarkment of the ship.
Yes, indeed. So we consider everyone who was on, all the passengers and crew who were on board the ship as high-risk contacts. While our colleague was on the board, we collected some data on the risks which on the exposures which the passengers had to some of the cases which were detected, and this information could be used to reassess in the future. However, we have now seen 2 cases who developed symptoms immediately after disembarkation. So our assessment is still that all the passengers need to be considered as high risk, and the director said we will consider the date of disembarkation as day 0 in terms of counting the quarantine period. The passengers are now in the countries, so there is an opportunity for further investigation at national level. So there might be some additional assessment, but with the information we have currently, we would recommend to keep considering all passengers as high-risk contacts.
All right. Thank you very much. We take the next question that is in the chat. It is from Leo Sands from the New York Times. It's a question to Mr. Spiteri. Can you confirm the total number of people currently in intensive care with hantavirus? Does that include the woman in a Paris hospital? And is there any update on her condition?
as of this morning, we understood that she was still in intensive care. And in total, yes, we have a total of 3 persons who are in intensive care. But this information changes very rapidly. So we will communicate on this through our website as information changes. Thank you.
Thank you. I think the next question also from the chat, and it is from Mart Foka from Bloomberg. So you advocate for the no regret approach, but different countries appear to enforce that differently. Does self-isolation at home for former passengers seem sufficient to you in that context? Also, can you confirm passengers still took meals together on the ship even after the outbreak became clear?
Yeah, so in terms of the quarantine, the way in which quarantine is implemented, ECDC recommends self-quarantine, and this can be implemented, of course, in different ways. And it is the countries which decide on how this is implemented nationally. And the decision can be based on different types of or different considerations, including the availability of institutional quarantine. Also, it can be on a case-by-case basis. So if a person is able to safely quarantine at home and has the facilities at home and is close to a medical facility in case there is a need for evacuation in case symptoms develop, then that could be fine. But if a passenger, for example, does not have a hospital nearby which has adequate facilities to take care of him or her in case of symptoms, then maybe institutional quarantine is more appropriate. So this can be decided both at national level but also on a specific individual level to take the most appropriate care for the passengers. We need to remember they have been on a boat for a month, not visited, not seeing their loved ones. So this needs to be taken into consideration as well. But of course, the key priority is that it should be safe for the passenger and for their loved ones. And then the other question was in terms of the measures taken on board. We understand from our colleague who was on board that there was adequate space on the ship. The ship was not full, so there was a place to keep social distancing at all times, including during meals on the ship.
Well, so we're moving on to a question from David Steger from 24 Hungary. Was all the 29 passengers who departed the ship in April successfully located and isolated?
Yes, so we know that the passengers from the European Union have been located and are under quarantine. We also know that the WHO and the South African colleagues have been organizing the contact tracing for the passengers from the rest of the world. We do not have all the details for the passengers outside the European Union, but we understand from WHO colleagues that these are being managed in the appropriate way.
All right. I will take the 2 next questions together as they are related. It is question that came into the chat from Stephanie Benz from L'Express, but as well from Pedro Catano from the Portuguese news agency Lucia. So has the genome of the virus been completely sequenced? If not, when will it be? And the second question is, just to be clear, does the ECDC completely reject the possibility that this is a new strain of hantavirus?
I can take that. So the genome of this virus has been completely sequenced. And on the second point here, I'd like to reiterate, so we make our assessments based on the available data that we have. At the moment, like I said at the beginning, there is no data to suggest that this virus is behaving differently in terms of transmissibility or severity from any of the known virus circulating in certain regions of the world. And based on that data, I would say that currently we have no reason to suspect that this is a new virus. Thank you.
Not. I take the next question in person. So that is Johannes Petterhead from ORF. Please, you can ask your question. Thank you.
Yes, Johannes Peter, Austrian National. Can you hear me? See me?
Yes, we can.
Yes. Johannes Peter, Austrian National Television. I have a question for the director. As an Austrian political journalist, this is giving me strong nostalgia. Ms. Rendi-Wagner, just overall, I would be interested in your assessment for our audience because they obviously know other viruses as well, and to many the hantavirus is still sort of new. So I was wondering if you could compare it to other viruses that we have seen, such as Ebola or other viruses. How dangerous is this virus, and how contained do you see it to be? Thank you.
Well, regarding the hantavirus, it's a virus which is known for a long time. It's not a new virus as such, and even I don't know if you heard the beginning. I just start from the beginning. Hantavirus is for a long time a known virus. Even the subspecies of Andes is known for many decades. I think even 5 decades we know about in the medical literature about the Andes virus. Compared to other virus, it's not that easy to compare virus and virus, but what we know so far from Hanta, that the transmissibility needs a prolonged period of exposure or very intense contact. This is, if you compare it, for example, to measles, this is like a much less risk of transmissibility than compared to a measles virus, which is much faster and easier spreading than this kind of virus. So it's not easy to compare as such.
All right, thank you. We are going to give the floor to Tommaso Galavotti from ADN Kronos.
Yes, Tommaso Galavotti, ADN Kronos, Brussels. Just one question, because is there any chance? I understand that the hantavirus has been known for a long time, and I guess that it's the same virus, if I'm not mistaken, which killed the gene Hackman. But is there any chance that this virus, this Andes virus, can mutate in order to be more easily transmissible from human to human, latex?
With regards to the Andes virus that's circulating right now, I believe it's different than the virus that killed Gene Hackman, because the Andes virus is the only one in the family of hantaviruses that is transmissible from person to person, which is why this is a little bit different than that. Viruses can mutate over time, but again, there's no reason right now to suggest that this one has mutated to become more transmissible. What we're seeing, I think both on the epidemiological and the microbiological side, suggests the virus is acting the way that they normally do. So I wouldn't entertain that very much. Thank you.
The next question comes from Christine Singer from ORIAF, and it is in the chat. It is said today that it was an Austrian on a plane together with a high-risk person who therefore is now considered a low-risk person. How could that happen if there were special planes for all passengers?
I'm not aware of this specific case. What we know about is that a number of passengers have been contact traced because they were on a flight from St. Helena to Johannesburg, where one of the cases boarded, and then she passed away in Johannesburg a few hours after boarding another flight, which was due to go to Amsterdam. And we know that for both flights, passengers are being traced, and it's important that the passengers who are contacted on these flights are quarantined, because they're assessed as being at high risk if they were in the 2 rows in front or the 2 rows behind or same row as the passenger who passed away. For other passengers we recommend that they monitor for symptoms, but they would be considered as low risk. And in this sense, they can go on with their normal life. But if they develop any symptoms, of course, they need to contact their healthcare providers and BSS and mention that they have been on a flight. So far, we have not seen any cases, any cases linked to flights where this case was on board. But incubation period is quite long, as you know, so there's still some time until the 6 weeks pass. And we would continue to observe this as the situation evolves. Thank
And I'm going to give the floor to Kai Koprivschnitt from Science Magazine that has a follow-up question. Please, Kai.
Yes, thank you so much. I just wanted to check whether there's anything you can say at all about what the epidemiological investigation on the boat, so on the ship so far, has shown, just in terms of the situation on board and the likely spread. It seems so important to understand the risks. So what's kind of the first impression, maybe, in terms of what might have been happening on board, just in terms of ventilation, all of these things that you'd be looking at?
Yes, so as I mentioned, our colleague on the ship, together with the Dutch public health, the Dutch medical colleagues, have started investigating the risks on the ship. What we understand, our hypothesis currently is that the first case was likely infected while traveling in Argentina in the weeks before boarding the ship. Most likely, this passenger transmitted the virus to the other passengers who acquired it on board, and it seems that the incubation periods fit with this process. As we have mentioned, there is a need for close contact and usually prolonged contact to transmit the virus. So this is still under investigation, the specific contacts between passengers. But the information we have is that so far the pattern seems to follow this approach, that there was close contact between a number of the passengers, and as you know, one of the cases was also the doctor on board, who had, of course, very close contact with the passengers who were ill at an early stage of the illness.
All right, thank you very much. We are now going to take the last question from Sarah Heyman from the Swedish radio, from the chat. Do you have information on how many people were exposed when the Dutch lady flew to South Africa and collapsed at the airport, and if all those have been traced and contacted?
As I mentioned earlier, no, we do not know exactly how many passengers were exposed. We know about the passengers from EU member states. We're collecting additional data from countries as we speak on the number of contacts which are followed in EU member states. We know that WHO is doing the same for countries outside the European Union, and that the South African colleagues have been contact tracing relating to this specific event in Johannesburg when the passenger was removed from the flight and then collapsed in the airport. So all the measures are being taken, but we do not have exact numbers on the number of passengers which are being followed currently.
And with that, we would like to thank you very much for coming today to this press conference organized by the European Center for Disease Prevention and Control. We are now going to close this press conference. We thank you very much.